Good morning, everyone. Thank you for attending our session. Thank you so much and welcome to this next session. It is my privilege and my pleasure to introduce you Professor Vaidya Balendu, our next speaker, who will be talking about the role of Ayurveda in cancer care and integrative approach. Without any further ado, I'll be sharing the slides. I'm sure it will be a very fascinating and interesting talk. Let's give it a hand.
Thanks to Union Yoga Ayurveda Singapore Kembangan branch for giving me this opportunity and inviting me in your webinar. So without taking much time, I am going to start my presentation. Ayurveda understands these neoplastic malignant diseases. There are different disease conditions which come under this broad heading of cancer, like superficial swellings in the name of arbuda. Non-healing ulcers are also in the ambit of cancer. Malignancies of internal structures, body structures, and there are different disease conditions which come under, and they are represented by their clinical presentation, site where they are present, and the course of pregnancy, course of the disease, as well as their termination. Finally, the prognosis. All these things, presentation, site, course of the disease, and prognosis decide any disease to be a malignant disease. As such, this term cancer is not available in Ayurveda literature. There are different disease names which has been given. And at the outset, I may tell you that except these superficial swellings which are non-ulcerated, they comes under the benign type of cancers, whereas others which metastasize and which involve the whole body or ulcerate and spread and have a bad prognosis, they all come under the malignant disease condition. So in Ayurveda, there is a sequence of progression of such diseases. Phase of first of all is the phase of accumulation of the vitiated body humors. Wherever it aggravates, initiate and transformation takes place, then it invades in some local tissue by breaking the local barrier. Then it gets localized where growth starts appearing, it starts vascularizing, and the manifestation of the proper cancer disease happens to be there, and which causes the structural and functional disturbances in the body, and ultimately it goes into the phase of complication, which is the stage of metastasis and organ failure and function failure. So if we see in toto the health seeking attitude of the public towards the Ayurveda system, I will be talking to general diseases and cancer as well. In incurable and refractive disease conditions, people prefer to go to Ayurveda system. In some non-life threatening conditions that may be chronic and like neurological disorders, etc., arthritis, etc., where they have to go for a long-term treatment, they prefer to go to Ayurveda system. In cancer, in the is the second largest group of users who are struggling with the chronic and potentially ill-threatening disease such as cancer, HIV, and AIDS. People prefer to go to Ayurveda system. This health-seeking attitude towards Ayurveda in cancer is due to these reasons. People has a faith, belief in advantages of Ayurveda. Family traditions and culture is there. Emotional support they get from the traditional systems, because traditional system also talk about the Sattva Vijaya Chikitsa, means they have a psychological support therapies are there in Ayurveda system. That's why they get emotional support also. Expectation of better quality of life through this system, and to boost their immune system, prevent the recurrences, and dissatisfaction with the conventional therapy is one of the reason they prefer to go to the Ayurveda system, and also to obtain a synergetic effect with conventional therapy of reduction of side effects of the conventional radiotherapy and chemotherapy. That's why they prefer to go to Ayurveda system. So if you see the overall scope of Ayurveda in cancer management and prevention, I will not be going into the very core fundamental issues of disease progression, but the scope is in primary prevention, in secondary prevention when someone is already suffering, these secondary metastasis may not happen, and in the tertiary care where the quality of life is attainment of quality of life, adding happy days to the misery of cancer chemotherapy and radiotherapy, they prefer where the Ayurveda can help. And this management can be in a preventive phase also, as a standalone and as a add-on also. That depends upon in which stage his patient is. If it is in a very initial phase, then a standalone therapy can work, whereas already patient on radiotherapy chemotherapy, then add-on can be there, and that can be add-on can be in two ways. Curative, we add curative medicines also, we provide the palliative care also, and that adds into the main line treatment. So this is the strategic line of treatment in cancer care in Ayurveda. So how we do it, the in the center you see the bluish triangle, that is a core issue, that's why it is kept in the center. uh, One has to go by the lifestyle and diet. That is this is the major attribute potential of this system of medicine, where this has to be followed for prevention, for add-on, and in palliative care also. Unless otherwise it is done, no systemic and local therapies and no palliative care will work. In systemic treat management protocol, we do the seasonal this biopurification cleansing treatment. Then we give the palliative care medicines which check the progress of the growth and disease. And lastly, after this disease progress is checked and biopurification is done, the mainline treatment which we go for Ayurveda is a Rasayan Chikitsa. I'll be talking in the next slide about Rasayan Chikitsa. The local treatment, when it is a local swelling or ulcer, then we apply the ointments, we irrigate the area with medicated fluids, watery fluids, oils, grit, and then we provide a gentle massage also. The cauterization, Agni Karam, and caustic application, Kshar Karma, are also the mainline local treatments for cancer care. So this is the management protocol in Ayurveda system. So these are treatment protocol algorithms. What can be done in which condition? If it is a to reducing the toxicity, we provide the management. For conventional curative care, mainline allopathy treatment is going on. There we add the Sattva Vijaya and Rasayan Chikitsa. Where conventional palliative care is to be given, then according to the symptoms, Rasayan Chikitsa and Sattva Vijaya is given. When completed conventional treatment and intention of non-recurrence, to check the recurrence, we provide Shodhana, Rasayan, Sattva Vijaya. If some patient is left out by the conventional treatment, no, they have nothing in the modern medical system. They leftover patients, they are also provide the same line of treatment. And as a proper treatment of cancer through Ayurveda, there also we go by the dosha, lakshana, viprit chikitsa, and according to the patient's physical and mental health, a Rasayan as well as Sattva Vijaya, the psychological support treatment through yoga as well as through counseling. These both systems help in the Sattva Vijaya part. And primary prevention, that happens to be, as I told earlier, the lifestyle, diet, seasonal biopurification, Rasayan, And these are the different algorithms which we broadly adopt in the different stages and according to the different requirements in the cancer patients. So integrative Ayurveda in oncology, the goal of the integrative approach is to enhance the quality of life, to minimize the treatment related morbidity toxicity like dyspepsia, fatigue, xeropstomia, swallowing problems, and later toxicities. Palliative care for pain, nutrition, sport, sexual problems, psychological issues, depression, anxiety, adjustment disorders, and delirium. In rehabilitation for neuromuscular, radiation fibrosis, post-surgery jaw opening, lymphedema, etc. These conditions require rehabilitation. There, the integrative approach can help. And wherever the special care for terminally ill, where they have a dyspnea, bowel obstruction, biliary obstruction, gastric ascites, wound, where the especially palliative care can be provided through integrating the Ayurveda system. So now I am coming to, this is the basic fundamental treatment approach and integrated approach goals which I have already explained. Now I am coming to the main therapy which we go by through Ayurveda after addressing the symptoms and by adopting lifestyle, diet, and then the mainstream treatment goes by Rasayan and Sattva. The yoga people will be talking about Sattva. That's why I am not touching that part. I am just dealing with the Rasayan. So what is Rasayan? Friends, Rasayan is not a tablet, not a capsule, or not a single medicine which can be given termed as a Rasayan. A Rasayan is the overall effect which we achieve through a healthy living lifestyle, healthy diet taking, and positive approach towards life, and having a balanced psychological system, and wherein also comes the company of very good caring people is also acting as a sign. If you are living in a not good company which are mentally supportive and supportive to you, that will not give you a rasayan chikitsa. So achara rasayan, what is your behavior, how you deal with the society, and how you have a company, how good company you are having with your friends, family, and others at your workplace also. All these things combiningly give a rejuvenating and a healthy atmosphere to your body, that gives a rasayan effect to you. So the Ayurveda approach for treating and restoration and preservation of health is achieved through adopting this rasayan approach, not only of medicine but in toto. That can improve tissue functions and organ functions and systems, biology improvement, they can give disease specific effects, and they help in symptom management also. They improve the quality of life, and they also reduce the disease gravity. So because the rasayan effect leads to immunity, and in the concept of immunity in Ayurveda is prevention of the primary disease and reducing the effect of the disease. If it has happened, it will not terminate into complication. That also comes under the immune system, which is achieved through the rasayan therapy. So in nutshell, how this rasayan affects. So for having a rasayan effect, we need a nutrient diet and lifestyle. We need a very good agni, that is digestion and metabolism, and we need that our microcirculatory channels are very clear, so that whatever is digested and metabolized through our agni, and that should reach to each and every cell of the body through these clear microcirculatory channels, so that all these things are available, nutrients are available to each and every cell, and overall through these three factors a improved nourishment happens to be there. And not only nourishment, the metabolic process as well as the clear microcirculatory channels will also help in transportation of the waste products to the excrematory systems. So this is a two-way mechanism, reaching out the micronutrients to the cell and taking the end metabolites, waste products, which we call mala in Ayurveda, to the excrematory systems is also the work of microcirculatory channels. And through this biocleansing, seasonal biocleansing, panchakarma, we achieve this microcirculatory clearance, so that nutrition is also available and waste products are also taken out of the body through this circulation. And when the balance of nutrients and end products removal is maintained, that gives the improved nourishment. It's not the one way process only. This improved nourishment will improve the quality of the tissue, improve the functions of the tissue, thereby an individual will get a longevity, immunity, and mental competence. If these three things are achieved, that is the process of rejuvenation which we achieve through this RASAYN effect of our total activity, lifestyle, diet, etc., through this RASAYN. Okay, I think the concept of RASAYN will be very clear after this. So the possible attributes, as I have told you, what can be the attributes through RASAYN: nutritive, immunomodulatory, and potent micronutrients, antioxidants, adaptogenic, support the sensory and motor systems, and motor boosters, and aphrodisiac effect, and anti-aging effects. All these effects, more than that, which the modern science will still evolve, what more can be there as a immunomodulatory and immune effect, they all will come under this RASAYN effect. So I am just citing some of the plants: Ambelica officinale, Tinospora cardifolia. There is a lot of literature where their immunomodulatory and RASAYN effect as per Ayurveda has been ashwagandha, Videnia somnifera, Ocimum sanctum, this Asparagus racemosus, Glycyrrhiza glabra, and Bacopa monnieri, the Centella acetica. These are very potent drugs. This is just exemplary medicines which are already have been proved to be RASAYN, and vis-a-vis their immunomodulatory effect has been tested by immunopharmacological activities, and they are available in the Ayurveda system of medicine. So now Ayurveda in cancer care as a standalone, add-on conventional cancer care, the most common use in India by cancer patients. Standalone is very less even today, but add-on by prescriptions, by physicians consultation, as well as of their own also, because Ayurveda is a social and cultural system of medicine in India, although having a strong scientific footings, but it is so prevalent and close to the hearts of the people. Many public in India, we see that everyone is a doctor, because they know, every family, every person know home remedies. So add-on is the most prevalent permutation is available. Need for cooperation between Ayurveda and modern physicians is with mutual trust. Integrative oncology program have been initiated in few institutions across India. Modern hospitals has also adopted and added to their cancer units the integrated oncology program, but it is very less. However, there is a positive evidence to the specific benefits to the patients, which will come by passage of time. Case reports abound vouchsafing the benefits Ayurveda treatment in management of cancer. However, rigorous studies are still awaited. So what CCRAS has done in cancer care, I am just coming to that point. In vitro screening of these plants has already been done by the council, and publication is available. 9 drugs, potent drugs, has been tested, and they are testing on different cell lines, and most potent effect on which cell line we got out of these 9 medicines. Most of them are on prostate and colon, whereas certain has a specific affinity to certain cell lines of oral cancer, lung and leukemia, as well as prostate. So this work has been done, and clinical studies has also been initiated. They are there, standalone therapies of Ayurveda and complementary to combination, conventional combinations. For clinical safety and efficacy, the goal of these clinical studies were improvement of quality of life, overall survival of the patients, whether we could increase the survival and event-free survival, could we add some happy days to the misery of their life, and progression free survival, whether their progression or relapse of the disease happen to be there. These 4-5 objectives were kept in our clinical studies. So this is the biggest study we have done, where Panchkaram, very initial therapy of Snehan Karam was done, and 6-month intervention with these 4 Ayurvedic drugs was done in 400 patients. A 10-year study it was, which was followed for 5 years, and different types of cancer were intervened, and these cancers were of different sites and at the different stages. So these were the groups. The group 1 was the modern line of treatment without any intervention, and all other 7 groups, 6 groups were given a Ayurveda intervention along with the modern treatment, and the last one, 7th group, was only on indigenous drug alone, whatever 4 drugs we have told. So that way this study was done, and you can see out of these 400 patients, these patients have undergone different treatments of radiation plus drug, radiation chemotherapy, radiation alone, chemotherapy plus drug, chemotherapy, radiation and drug only, and no treatment was given. So these 400 patients were of different treatment regimes, and the involvement of different systems. You see hepatobiliary system predominated in the, followed by breast cancer, preceded by breast cancer, and also followed by GIT, main involvement in 400 patients. So now you can see distribution of which type of cancers they were suffering. They were all segregated accordingly, and what we result outcomes, what we saw in terms of weight gain, percentage of hemoglobin increase. This is one of the antioxidant glutamate decarboxylase activity, and cytotoxicity effect by phagocytic effect, and immune function, and survival and lifestyle. So now you can see the increase in the percentage of survival by addition of Ayurveda therapy to the conventional treatment. You see those who were on radiotherapy alone, percentage of survival increased by 17, whereas those who were on radiotherapy with Ayurveda, their percentage of survival was 50%. Chemotherapy alone, their survival was 39%, whereas chemotherapy plus Ayurveda, you see the survival rate increased to 76%, whereas radiotherapy and chemotherapy was there, the survival rate was very less. You see the radiotherapy group with radiation, the survival rate decreases, whereas addition of Ayurveda therapy has certainly increased the survival rate in case of radio chemo with Ayurveda to 65%. You can see if this much of survival rate has increased, it means the Ayurveda system of medicine is working. So significant increase in hemoglobin, prevent fall of hemoglobin, loss of body weight was inhibited, and a significant gain in weight was there, increase in GAD level, increase in survival period, improved immune status by evaluation of IgA. These were the outcomes. So now the recent drug trials of Ayush QOL2C, this recently completed study. So all these objectives were, but different cancers were intervened. You see, at New Delhi, we intervened in breast cancer, the first study. You can see the trend toward better local and survival of the in the Ayush group was there. In lung cancer, which we did in Jaipur Cancer Hospital, there also the overall survival of the patients was comparable with that of the placebo and modern treatment. So in Bangalore, we did again another study in breast cancer, where on also you see reduction in fatigue, improvement in weakness, positive impact on loss of appetite, improvement in nausea and vomiting, improved the constipation condition, relieved the constipation condition, and improvement in sleep pattern was also there. So the add-on effect of this QOL2C in all these cancer patients have a additive effect towards the positive side, which we has already completed. So as compared to the placebo, Ayush quality QOL to show improved in physical well-being, significant improvement in functional assessment, improvement in total FACT-B score, which the cancer patients are assessed upon, improvement in Eastern Cooperative Oncology Group performance status in patients of 4 cycle of chemotherapy, found clinically safe and no adverse effect with this add-on therapy was there. So again, the cannabis is in on. Yeah,
Doctor?
I'm finishing. I'm
Okay.
finishing.
Okay,
Yes,
sure.
yes. This is the last thing I am going to tell you. Friends, a role of cannabis sativa, this marijuana leaves, which is permitted in Ayurveda system. This has been done, and this has added to the palliative care with pain, nausea, appetite reduction in chemotherapy and radiotherapy patients of cancer has significantly improved, and this article has already been published. It is in public domain. So I'll be finishing my talk by saying this much, although I have a lot to say what Ayurveda can do, but integrative oncology has certainly a role. There is a need at the international level that there should be a society or a forum for integrative oncology where Ayurveda and Yoga can play a real role in this incurable disease. Thank you very much. Thank you very much.
Yes.
Yes.
Am I audible? Okay, brilliant. Professor Dhiman, thank you very much for your informative presentation. We already have some questions coming.
Some questions in the chat box.
Maybe
So-
Jana Eng Fries, you want to unmute yourself to ask your question, Jana?
Yeah,
Yes. Good morning, doctor.
yeah.
I would like to ask if Ayurveda can help basically in maintaining the cancer markers low after, let's say, 8 cycles of chemotherapy. In case of stomach cancer, where the cancer markers went down from 2000 to about 200.
Yes, certainly. If the total treatment protocol is adopted, that I told in terms of bio-cleansing, followed by this Rasayana Chikitsa, Rasayana treatment, rejuvenative therapy. If total protocol is adopted, if already 8 cycles of chemotherapy has been taken, it will certainly help in maintenance of the cancer markers, keeping the
Okay.
cancer markers low, certainly.
Okay, thank you.
Barbara Ettenhäuser.
Thank you for having a word. Actually, the cannabis, it's a huge topic, and I'm as a German, there is a lot of discussion going on. When the patient is at its last stadium, I think it's also important to keep the quality of life high until the end. Is there an opportunity to give them or support him with cannabis until the end, or do you recommend other medications of Ayurveda?
Not only cannabis. Cannabis is one of the molecule which can improve the appetite, improve the sleep, improve the mental status, as well as improve the reduce the vomiting. This is one of the medicine along with, but to keep the quality of life to the end of up to the end of this lifespan, the other measures of Ayurveda intervention has to be adopted along with.
Okay, thank you. One short question. Is it recommendable that you combine the modern medicine with the Ayurvedic medicine, or should the doctors work together, and how do they work the effect together?
No, in our system we don't cancer treatment is given to the patient only by oncologist in our country, and wherever we have taken these trials, the modern treatment was given by a modern doctor and Ayurveda treatment was given by Ayurveda doctor. So it is the mutual consensus in which stage the add-on treatment is to be given, and respective treatment will be given by the respective experts.
Thank you.
Okay, so Eileen has a question.
Yeah, hi, doctor.
Hi.
So I've got a question. So for Ayurvedic herbs, right, it will be is similar to, like, say, Chinese herbs. They will have certain kind of nature, like it's cooling, heaty, or whatsoever, or that is neutral. So for each individual person, they will also have a different kind of body nature. Like, say, some people we say we have got a I don't know, more heaty kind of body nature. So it's also dependent on the person's body type.
Yes, I got your question. Now let me answer.
Okay,
so
thank
Chinese,
you.
To be very true, they agree or not agree, the Chinese system is the tertiary development of through Ayurveda. From the 6th century, the Chinese scholars took this education from India, and later on this system has gone to China. No doubt, all herbs have their own qualities, like cold and hot and neutral, etc. And similarly, each individual has its own temperament, and each disease origin, again, all these attributes in an individual are assessed, and not all cancer patients are having same symptoms. The gravity of symptoms and quality of symptoms in different patients is different, and accordingly the herbs are selected according to the quality of the herb. So that is a very common to Chinese system as well as Indian system. But Indian system is not only dependent on cool and hot and neutral. There are many other pharmacological attributes which our system say, and accordingly the disease condition as well as the individual's body physique, these both have a different temperament. So everything has to be evaluated before giving any herb, and that herb is given according to the requirement of the individual's temperament and the attributes or qualities of the herb.
Okay, thank you, doctor.
Okay, thank you, Eileen. Next up, Sandra.
Yes, thank you very much. I have a question about Panchakarma. Panchakarma is a very big topic in Ayurveda to cleanse the body, purification and detoxification. So in cancer patients, they are quite weak, and Panchakarma requires some strength. So in which stage or in which condition is the patient or the client able to go through Panchakarma, which is essential, what we hear in ordinary Ayurveda?
You are very right. You are very right. And according to the physical condition of the patient, which procedure can be given to that patient is selected by the physician, number one. And secondly, once it because see, if we require that this patient is to be given purgation, therapeutic purgation is to be given. So before giving that purgation, we have to see whether this patient is able to have a clear-cut indication for purgation or not. His physical condition and disease condition allows or not. Then patient has to be brought to that condition first by palliative care, by medical treatment, which we call shaman chikitsa. And once he adopts that stage, then and then it is given. So everything is taken care. It is not that patient from a modern cancer unit is transferred to Ayurveda and he will immediately be given Panchkarma. No. This system has a very clear cut. All three steps of a procedure are adopted: pre-procedure, main procedure, and post-procedure. So in pre-procedure, selection of the patient is the major part which the physician has to see. And there are the alternatives of each procedure. When we cannot given the therapeutic purgation, what can be done at this stage in a very very weak condition? What can be given? So that way we manage. Like if his bowel is to be cleared, we give this castor oil, 5 ml of castor oil at bedtime. So his bowel regulation will start, and once the patient gains strength, he becomes eligible for therapeutic purgation, virechan, then he is given virechan karma. Okay? It's not that all patients at every time will be given the same. No. It's not like that. This is a very subtle science, has a clear cut indications, contraindications, and risk management as well as complication management inbuilt in it.
Thank you very much.
Okay, hi, Doctor. I will ask the question for Gopa on his behalf.
Yeah.
Gopa is checking whether the survival percentage data from your PowerPoint is predominantly taken in India, or is it like a worldwide statistics?
No. This is on our trial patients. This is on our 400 trial patients which was done, and this is only from India.
I see. Okay, thank you. Petra, are you ready?
Yes, thank you so much, Dr. Dhiman, for this nice talk on your research. I was really impressed by the duration, because it spans 10 years, right? Your research on the 400 patients. So were there any major adjustments done in those 10 years of time? Did you adjust like some kind of treatments, or maybe add something to the treatment?
Pardon? What
because the research was spanning 10 years, right?
Yeah.
Yeah, and I was just wondering if there were any major adjustments done in those 10 years.
Yes, these patients continued for follow-up also. So in a cancer hospital in Mumbai and other hospitals, these patients were enrolled, and same line of treatment was given. 4 drugs, common drugs were given, and whatever Panchkarma was advised, they were all given.
Thank you.
Okay, Qian Qian, I think Qian Qian has a question. Qian Qian, would you like to unmute yourself?
Yeah, I want to ask, maybe I didn't hear very clearly during the presentation. Actually, what is the key role and what is the key function that Ayurveda plays in like suppressing those autoimmune disease? Like, could you maybe give a short summary to us?
You have shifted from cancer to autoimmune disease. You want to know about autoimmune disease. In autoimmune disease also, the Ayurveda has a very, very specific role, wherein also Panchkarma plays a major role. Panchkarma plays a major role. And there is a clear-cut concept about this autoimmune disease origin. I will be just briefing how these autoimmune diseases get their origin. If they are not genetic, in that case, there is a concept of ARM. That means some toxins get accumulated in the body due to poor function of the digestive system and metabolism. If the digestive system and metabolism of an individual remains at low pace, disturbed for a long time, then the ingested food does not convert into its original constituents in which the body should accept them, and they go in the body in the semi-digested and semi-converted form, and they get accumulated in the microchannels or body tissues or systems of the body, and they act as the toxins, and these toxins in turn create a reaction in the body when they become in a ample quantity in the body, and that reaction is known as autoimmune disease. And to check that, now again we require that the microcirculatory channels has to be cleared, the digestive and metabolism has to be corrected, and after these both things are done, then the accumulated toxins in the microchannels, body tissues and systems has to be removed through the panchkarma biocleansing mechanisms, and then patient has further to follow a strict diet and lifestyle regime to get rid of that condition. If in very early condition of that such autoimmune disease, the earliest the patient come to a Ayurveda physician, the best results are complete recovery from the autoimmune disease can happen. But if patient has gone up to steroids and other drugs, then the chances of recovery becomes 50-50. Okay, so there is a great role in autoimmune diseases also through Ayurveda.
Okay, thanks.
Okay.
Very well explained. Thank you, doctor.
Thank you, Tian Tian. I think Sandra, you'd like to speak?
Yes, I have another question. Western medicine has a huge financial support and from the pharmacy industry. What can Ayurveda and yoga do better to receive more financial support? What do you think?
You mean to say that financial support to the patients in terms of mediclaim and insurance, medical insurance, you mean to say?
No, for example, the study, we heard that it's very important to case study research to bring awareness, but the
yes,
money,
yes,
financial, we are not supported, right?
Yes, the amount of financial support which is required is less, but you know, in India we are getting through our research councils, we are being granted by Government of India, but the more requirement we need is that a integrative forum need to be made, and more cancer hospital has to come forward for this integrative approach. The fund management will not be a question. When we will work together, we will show the efficacy benefits to the patients. So total cancer research can divert towards the addition of these complementary so-called complementary system, Ayurveda, Yoga and other Ayush systems into that. So I think this is only the barrier. Barrier is only the less number of cancer hospitals coming forward for the integrated approach. Once it will start, funds will not be the issue.
Thank you very much.
Okay, doctor, are you able to read from the chat? Victoria has a question. Ayurveda is well established. The last few.
Ayurveda is well established and a well recognized science in India with plenty of research. Why in your understand doctors and especially oncologists in the West are so reluctant to use Ayurveda practices? There are many reasons. I won't discuss these on this platform. The only reason I want to explain is that number one, they are reluctant to use the Ayurveda protocol, whereas they want that we should tell them single medicine for cancer. But this our system does not work on that way. Unless otherwise we adopt a complete treatment protocol in terms of lifestyle, diet, biocleansing along with medicine. Unless otherwise we adopt this whole protocol in individualized manner, our system will not work. And wheresoever with single medicine, I tell you, I put here, presented the QOL2 clinical trial. That was a single molecule, and the outcomes are not to our satisfaction. Although this only single medicine has added into the quality of life, and certain parameters has shown improvement. But if the total protocol would have been adopted, a comparable result would have been there. So this, unless otherwise they understand that we should adopt the treatment protocol, and that to individualize. First of all, we have to see the potential through adopting the whole protocol, and later on we can squeeze and what is the minimum required Ayurveda intervention that can be given. And this is the only barrier which I think is restricting modern oncologists to come forward for trial.
Okay, thank you very much. Okay, well, this was a very informative session.
On behalf of the Union Singapore, we would like to thank Dr. Dhiman for joining us in this session, giving us your knowledge.
My pleasure, and my best wishes for the successful webinar in ongoing days.